I'm back in Mexico City after my trip to the United States. The first thing I did was meet with, on Friday evening, with the doctors from the health sector, with the Secretary of Health, Mr. Alcacer, with the Subsecretary, Hugo López Gatell, and the person in charge of the pandemic, of the coronavirus, with the director of Social Security, with the director of the ISTE, with the director of the INSABI. I met with the Secretary of Defense, the Secretary of the Navy, and those responsible for the health of those institutions to see how we were doing, how we were dealing with this pandemic, this COVID-19 pandemic. I would like to inform you that the report has been positive, has been favorable. The conclusion is that this pandemic is decreasing. It is losing intensity. There was a presentation on all 32 states in this country, and only in 9 of them has there been an increase in the number of cases. Out of 32, 9. In 9 states there has been an increase. In 23 states there has been a decrease in the number of cases. We are making sure that our hospitals are not saturated. From the beginning, we have been paying close attention to that, to the need that everyone that needs medical attention be able to have access to it. There are enough hospitals. There is enough room in the hospitals. There are beds. There is equipment. There is medical personnel specialized who are there to look after patients, those who are sick. Lately there has been near saturation, but not complete saturation. Maybe around 80% of the hospitals in certain areas were saturated. Now we are acquiring more beds, more equipment, specialized doctors as well. Not only to take care of the sick, but also we're also bringing in the best specialists to train other doctors. So we are doing well. In the case of the ICUs, the number of available beds is larger than the number of patients. In Tabasco, for example, they were at an 80% capacity, but in other places it wasn't as bad. There are many intensive care units. In Tabasco only, in the state of Tabasco, there is available room, and we can help those who are sick. And there is also another ongoing pandemic, that of alarmism, conservative alarmism. It's very sensationalist. So we have to constantly be updating and informing the population. They're comparing us to other countries, but they are not giving all the necessary information. I want you to remain calm. I want the people to remain calm. I want to assure you that we are improving. We are dealing with this pandemic in a very professional manner. They have undertaken a campaign against Dr. Hugo López Gatell, who is a professional, but they are constantly attacking him. They are very desperate because What they said would happen, what they hoped for, did not happen. That's, and I will not stop saying it, the cover of Proceso, where there was a crematorium oven. Can you imagine? There is so much alarmism. The newspaper Reforma keeps doing the same thing as always. They're comparing us with Spain, with France, without taking into account the number of inhabitants in this country. That's why comparisons are no good, because we're talking about human beings who have lost their lives. This is a very painful situation. So I'd like to express our sadness, and I'd like to extend my condolences to those affected, to those who have died anywhere in the world. But it is that attitude, irresponsible attitude, on the part of the conservatives in this country. I mean, that's why we have to constantly keep the people informed on how we are doing with respect, how we're doing compared to other countries. Look at this table. This table was compiled by universities in foreign countries, of a lot of countries. In the United Kingdom, for example, for every death that we've had in this country, in Mexico, they have had 2.4 deaths. In Spain, for every death that we have in Mexico, they have 2.2 deaths. In France, for every death we had in Mexico, they had 1.6 deaths. It's very unfortunate. In the United States, for every fatality we had in this country, they've had 1.5 deaths. In Brazil, for every death we had in this country, they've had 1.2 deaths. In that brother nation, in that Latin American brother nation. Well, this means that it's not what the press is saying does not accurately represent reality. We are doing our job. Not only do we have to take preventive measures to mitigate the effects of the pandemic, we also have to start transitioning into this new reality, this new normalcy. We have to take back our freedom. That is very important. There cannot be authoritarianism. We have to apply what was being said in France during the student movement in 1968. It is forbidden to forbid, because a lot of authorities have authoritarian tendencies. So we have to take back our freedom. We have to be able to go into the streets, to be able to go outside. If we need to, if we make our living in the streets, we have to be able to go outside. There are those who sell Jell-O, who sell bread. That's how they make their living. They have to be able to be in the streets to make a living. And how do we go outside? How do we go into the streets? Well, we have to be careful. We have to take care of ourselves. We can do it with social distancing. We have to avoid groups. We cannot allow large groups of people to assemble, to avoid the spread of the virus. But it's up to us. We have to wash our hands. We have to take care of our personal hygiene. We have to take care of ourselves. I think that by now we know what needs to be done. We have been constantly informing the population, the people. That's why I respect and admire Dr. López Obrador for the manner in which he has been constantly informing us of how to take care of ourselves, how to keep taking care of the elderly, of the sick. But it has to be a voluntary, a free attitude. We are responsible people. The Mexican people has acted in an exemplary manner. We have been able to, if we have been able to deal with this pandemic, it is thanks to the deliberate and responsible action of our people. That's why we're going to get out of this. We're going to keep improving. It is our obligation as the government to take care of the health of the people, but we also have to allow the economy to slowly start recovering, and that's what we're doing. That's why I went to the United States, to reactivate the economy with this free trade agreement with the United States. And we've explained that this treaty has come at the right time, at a very good time, as it will lead to more investments, more people will invest in this country. It will lead to the creation of more jobs. It will mean well-being for our people. That is with regard to industry, to businesses, trade in general, foreign trade. But we also have to remember that unlike other countries, we have decided to activate the economy from the bottom down, from the bottom up, instead of this trickle-down economy where it was going from up to down. We're doing it the other way around. We are giving subsidies to those who need them the most, who are at the bottom. That's why we have authorized 4 million loans during the pandemic after April. From April to now, and this will continue, of the 4 million credits that we authorized, 1,400,000 credits have already been given to the people, to those who ask for them. We're talking about an investment of 88 billion pesos. 88.1 billion pesos. This is the investment that we have authorized for these loans or these credits. Some of them are being given to artisans, to small businesses, small shop owners. Taxi drivers are getting these loans. Those who have stands in markets, waiters, chambermaids, musicians are getting these loans during this crisis. And at the same time that they're getting these loans, we are still distributing resources to students so that students have their scholarships. We're still helping agriculturers so that they don't lack resources to plant their seeds. We're helping fishermen, and we decided to advance, to give benefits to the elderly of 4 months in advance. We started in June. In 10 days, we are going to distribute in total. I think it'll take us the entire month of July. We're going to distribute 46 million pesos, 42 million for the elderly, and 4 million to handicapped children. We started on the 1st of July. How are we doing? Let's see. We distributed 26 million. There are 4 million elderly people who already have their benefits in their bank account. Alright, and this is making it easier for them to receive their money, their benefits. On the 1st of July, 43 million pesos were giving out for these elderly people. And of course, children with handicaps, they also received a considerable amount of money. 159 million approximately. We are giving out right now, and this is a little bit more complicated because we have to respect social distancing, and we're giving out directly to the elderly, and of course we're giving these loans out or these benefits out directly to these people, to the elderly and to the handicapped. I suppose that out of the 9 million people who have benefited from this, out of the 9 million people who suffer from a handicap, who have some type of impairment, we've already distributed these benefits to 6 million of them. We are giving 5,240 pesos to the elderly. And we're giving out 3 months at once. July, August, September, and October. And then November, December, we will give those pensions out at another time. Now we did this for 2 reasons. Number one, we need, our public finances are doing well. Our system did not collapse. Everyone is paying. The people are paying their taxes, and we've also been saving. But if we eliminate luxury in the government, it translates into this. And I've also taken the decision to give this out, these pensions out in advance, these benefits out in advance, because people need to come out of this. They need to be able to come out of this crisis. And we have to stay in family. We have to be together. We are going to get out of this bad moment, out of this bad situation, because our country is a big country. Our people are big.